Hello everybody, Bruce McGonigal here. More news out of Nanaimo. This time the homeless count has come out and it has shown that the homeless population under the BC NDP has jumped from 174 less than 10 years ago to a whopping 621 homeless people that were identified in the latest 2024 homeless count. Now, Dr. Bonnie Henry told us in March of 2023 that the First Nations communities and First Nations themselves were more impacted by the overdose crisis because British Columbia is basically systemically racist and colonialism plays a big factor in that. Listen.
It is a very different type of crisis, and it is a reflection of a lot of things in our society that have been going on for a long time. So it's rooted in colonialism, it's rooted in poverty, it's rooted in social disconnection and racism and other societal things.
So now it should come as no shock to anybody that this report that came out about homelessness in Nanaimo basically mirrors what Dr. Bonnie Henry said. John Raybeck, he's the report co-author, says, our finding shows that homelessness is a direct and ongoing legacy of colonization. You hear that, racist British Columbia? All of these First Nations people are homeless because of you and me and our ancestors, which is absolutely nonsense, folks. It's gaslighting to the extreme. The real people hurting First Nations in British Columbia are the very people giving the woke land acknowledgements where they say we are standing on the unceded territory of the Squamish First Nations. You know what I mean, right?
Hello everyone, I'm Adrian Dix, I'm BC's Minister of Health. I'm joined today by Dr. Bonnie Henry, BC's Provincial Health Officer. I want to recognize we're on the territory of the Lekwungen speaking people here of the Sanghees and the Esquimalt First Nations. We're honored to be here on their lands.
Those people are the ones killing people. It's got nothing to do with colonialism at all. Check out the data. The data says everything that we need to know. It first says that there is, out of the 621 people that they were able to identify, 75% of them say drug addiction is why they're homeless. Another 65% of those people say that they suffer from mental illness, which is very common with hard drug addiction because the drugs are so toxic right now on the streets that anybody that overdoses likely will end up with even minor to major brain damage. It takes longer for people to be revived because the drugs themselves are specifically designed to resist the effects of the naloxone/Narcan that is given to revive people when they are found overdosed. In fact, we now have to have cocktails that cost hundreds of dollars sometimes to revive one person simply because the government decriminalized not only hard drug possession, but decriminalized people poisoning other people to death, which is exactly what has happened. It's mass murder, right? So they cover it up, they hide the fact that all of these people are dying because the government said it's okay to kill them using hard drugs. That's exactly what's happened. We also know that in Nanaimo, 8% of the 8% of the population is First Nations. 30% of their homeless population is First Nations. So First Nations is dramatically impacted in the homeless situation. And there's a lot of reasons for that, and I'm going to go over that with you right now. First, First Nations communities are heavily impacted by foster care, where the government comes and takes children away. Those abusive homes, and trust me, there are so many that are abusive, the kids end up with very low self-esteem and often seek ways to kind of numb the pain that's in their life. What is our government solution, folks? Our government solution is to tell children that it's okay to do hard drugs, that it's okay to escape using hard drugs, and they flooded our streets with taxpayer-funded pills 5 times stronger than morphine and made it as cheap as $1. Okay? So when kids are looking to escape, you can either try and get somebody to go into a liquor store for $20 and get you a 6-pack or an 8-pack of beer, or you could try and get somebody to go down to the pot shop and buy you pot, Or you could end up going down the street for $10 and getting 10 pills on the taxpayer dime that gets resold by organized crime. The government loves that because the government gets programs in place and their insiders in place to become the drug dealers and those reviving people that the drug dealers are poisoning. It's a vicious cycle that is swirling down the drain. I pointed this out before. The statistics in British Columbia are brutal, folks. We have a drop of 6 years in the life expectancy of First Nations across the board in BC. That means in just 4 years' time, between 2017 and 2021, the life expectancy went from 73 down to 67. So people, instead of living to the age of 73, are only living to the age of 67 on average. To see such a drop like that in 4 years, a BC NDP rule and federal Liberal rule, is proof that their policies are the one killing people. And they're killing kids. It's not just the drugs, though, folks. They pack so many people in that the cost of living has soared to a rate that people cannot afford to live. It's not just First Nations that are dealing with it, but if you're poor, you're kicked out of foster care at 16, you're not going to find a place to live in most instances. So you will end up homeless in a very violent circumstance, surrounded by people who are chronically trying to get you hooked on some of the most addictive drugs on the planet. Many of these street drugs have 2 to 3 different addiction points, meaning they're specifically designed to cause maximum withdrawal in the least amount of time to ensure that people hooked on the drugs are going to do anything that they can to get those drugs, right? It's like being addicted to cocaine, morphine, and say, ecstasy all at the same time. Except it's way worse because all of the drugs that are being combined into this garbage are so lethal that even a little bit, like a couple of grains of salt, can be enough to kill, especially children. It's absolutely ridiculous if you look at what goes on in British Columbia and up north in British Columbia especially, where the overdose rates and the homeless rates are the worst. Then you look at the fires that have been burning out of control up in those regions, and basically from the spring all the way through to the fall, the government just lets them burn. 30-40% of the land just burns away, and people have to stay on evacuation order and alert for extended periods of time. I'm talking months and months and months. And like we see with Lillooet, when it burned down, what's the government really doing to rebuild it? Almost nothing. So all of these communities are being devastated, being forced to evacuate, and then they're going to communities, whether it's Nanaimo or Vancouver or say Kelowna or Prince George or Prince Rupert or Kitimat, and they are finding super cheap taxpayer-funded hard drugs that people will assure them will help them feel better, right? When you're poor, you're down and out, and everything is going against you over and over and over again, the last thing that you need is taxpayer-funded drugs that are 5 times stronger than morphine going into your system. Now, I'm going to get to the next part here in Nanaimo because this is so important. The mayor decided that he has a solution for why there are so many foster kids on the streets and former foster kids. This is what Mayor Leonard Krog said. This is a shocking suggestion, but I am beginning to think that some folks should be in what I would call, hate to use the term, an orphanage. Now look at what he thinks an orphanage is. You can form long-term relationships with the people who work there, people who work in a loving and consistent environment where they don't feel abandoned on a consistent basis. Does that sound at all like foster care or group homes? No, it doesn't. In fact, when you get these staffed scenarios, which I've been through personally in foster care, you have dynamic personalities that can be somebody that's empathetic on one day to somebody who's very hostile on the other, and everybody within that environment that's in charge of the children rally around each other, and it becomes us versus the kids. That's exactly what happens. And the kids then tend to come together themselves and start sharing their bad ideas, their experiences and their addictions with each other. When children have been abused, they need a loving, caring environment, or at least a safe environment where the people aren't just indifferent to them, but have actual responsibilities. Even if they don't love the child, they're still being paid to look after the child, and there should be responsibilities for that. But we should not be surprised that the mayor of Nanaimo, who's a lawyer, by the way, is completely clueless on how the system actually runs. Because this is the same man who said that he has a duty to protect his staff at City Hall and City Hall property, and so he is going to spend huge amounts of money to build an iron fence around City Hall in Nanaimo because there is so much violence, chaos, theft, and intimidation from the nearby injection site, right? The community's screwed. The community still has to live with that injection site and all the chaos, but the mayor, who's supposed to protect the community and the city at whole, turn around and is ignoring the threats to the community while protecting himself and the bureaucracy. It's absolutely mind-numbing that these people get away with that, especially when we know that so many of the homeless people in Nanaimo are First Nations. Instead of giving them hope, instead of giving them a direction forward, our government wants to give them as many pills as possible, revive them as many times as possible, and then keep them on the street to keep doing it over and over and over again. That's why they're not locking up these drug addicts, because they're profiteering off of it. The government gets to set billions aside in their budgets to manage addiction, because they have decided being an addict means you're mentally ill, which means that it's okay to kill you if you're a drug pusher, especially if you're a drug pusher for the government. And that's where this has become so insidious, folks, because the poor kids in foster care are likely going to government-run youth clinics that tell them that it's okay to do hard drugs with a buddy. Can you imagine that? You're telling little kids as young as 12 years old to do hard drugs with their friends, and if they don't make it one day and their friend dies because they're not there as the buddy to make sure they're naloxoned, what do you think that does psychologically to those kids? Knowing that their friend died and they were the ones that were supposed to be there to revive them. What kind of guilt trip do you put a kid on that? And how is a child supposed to get away from drugs when they're actually now committed to making sure that their friends don't die while doing those very drugs? It's madness. It's child abuse. It's abuse of taxpayers' funds. It's abuse of the community. And it's decriminalized mass murder. That's exactly what it is, folks. We can't get away from the truth on this. It's the Liberals and the NDP that have waged war on British Columbians using our own tax dollars. So if you can't get health care, if you can't get surgeries, if you can't see a specialist, just remember, the government spent $184 million alone just making sure that people could get high or wasted on government safe supply. Right? $43,000 in 2 years was spent on each recipient of the Safe Supply program, be it the bureaucracy itself or the pills, which were 22 million pills that David Eby purchased. They flooded them onto the streets. When they knew foster care kids were dying in huge numbers from Safe Supply pills, they covered it up. And we know that half of foster kids are First Nation kids. So folks, when you have children living in poverty, when you have children being abused, neglected, or exploited, and then the government's telling them to go to injection sites and that Safe Supply pills will keep them and their friends safe, you know who the drug pushers are. You know who the child predators are. It's not even a guess anymore. So when they tell you it's colonial racism, the only colonial racists are in government, because none of us want to pay for that. I certainly don't want to pay so that people can stay wasted on drugs and so that little kids can become new drug addicts to keep government programs running. I hope everybody learns a lot from this video. It's so important that we have these frank conversations about exactly what is going on, because otherwise it's going to continue and it's going to get worse. Take care, everybody. Have a great one.